Hi everyone, it's Dr. Johnson, aka the layman's doctor. So you need to get a COVID-19 swab done. I'm here to tell you that you shouldn't be afraid, and I have some tips and tricks for both you who are getting swabbed and for your healthcare worker who is going to swab you on how to make the experience better. I know that swabbing or hearing that you need to be swabbed can be a seriously scary event. It's just like, oh my god, this thing is gonna be going to the back of my nose, into my brain, blah blah blah. And you know, sometimes the process of getting swabbed can be scarier than the actual event. Now, most of the reviews that I've seen about swabbing have not been great, and this just kind of propagates more and more fear around the entire ordeal. I've maybe seen only one or two posts or videos just saying the swab doesn't have to be painful, or it wasn't painful, it's just uncomfortable. I'm here to let you know that it should not be a painful experience, and you may have only mild discomfort. And I'm really encouraging persons who have been swabbed and who are okay with disclosing that information to share with friends and family. That is not such an uncomfortable event if you had a good experience. Now, let me tell you how to make it better. First, we want to know about the process. In Jamaica, we swab both the oral cavity and the nasopharynx, or the oropharynx and the nasopharynx. So in total, you get about 3 swabs, because you get 2 in the nostril, or 1 nostril each, and then in the oropharynx. The one in the oropharynx goes to the back, like here, the back of the throat, and you might feel like you want to gag because, you know, you're touching that little dangly thing, the uvula at the back, which controls your gag reflex. That's a normal reaction. The next one is going to go at the nasopharynx, which is kind of at the back here. That's the one that a lot of persons say it burns, it hurts, it feels like they're scraping their brains and all that kind of madness. If you do it properly, it should only have mild discomfort. It's important to know about the test and what is going to happen, and in an effort for this to kind of bring down the level of anxiety that you're going to have towards getting the test done. How is the test actually done? For the oropharynx one, that's super easy. You basically open your mouth and say ah, you know, like when you're looking back at the back of the throat. If you've ever had a throat infection, it's just like that. You just look at the back of the throat and say ah. My door just opened. Ah, and then the healthcare worker is just going to sample at the back. That one, you might feel like you want to gag, you may want to throw up a little bit. That's fine. That one is not the one that persons are concerned about. It's the one that we see in the media where we're going, oh my god, they're going all the way at the back of the nose, or oh my god, they're going into the brain. Or you're seeing those videos where persons are holding on to the healthcare worker saying no, or screaming while they have it done. A lot of times I think that these reactions are because we're already afraid of getting the swab done, and not actually because the swab is uncomfortable. Now, how can you have a successful nasopharyngeal swab? Well, we have to look at the anatomy of the nasopharynx. So it's important that you just kind of extend the neck just a little bit so that the nasopharynx becomes parallel, you know? So you just imagine that you have the nasopharynx and you want the nasopharynx to be parallel. This way, you are unlikely to hit anything or hurt anything. You just want it to be the best way possible. I say look into the actual nostrils, because you kind of have an idea of what the turbinates are doing or how the anatomy of inside the nose is. For some persons, especially if they're symptomatic, the turbinates might be super duper swollen, and you don't want to go, you want to be as medial or as close to the septum as possible. But the best way to do it is that you want to go low and you want to go slow. That is the best way. And I actually learned this from a doctor, Eric something, I can't remember his name, I'll put his name up somewhere, who really got me interested in doing, he's a ear, nose, and throat physician in Australia, and who really advocates for nasopharyngeal swabs and doing them properly, because they can be done painlessly. So you're going to go low and you're going to go slow. And for some swabs, they actually have a part to say, stop, this is how far you should go, don't go any further than this. But you may also have to use your gauge and use a difference in resistance. When you reach the back, you might feel just a little bit of resistance. You don't want to try and push because you might cause damage. And I find that the more swabs you do is the more aware you get of how much exactly needs to go in the nasopharynx. Now, what happens if you're going in and you're having a little bit of resistance? Well, and you're not at the back of it yet. Well, in that instance, you want to reposition. Sometimes it can just be mucus, and you maybe want to twirl the swab a little bit and go inside, or you may actually want to reposition fully, going closer to the floor and going more medial. Medial is towards the midline than anything. I would avoid going really close to the septum, but also you don't want to go too laterally as well. You just want to go low and you want to go slow, and what you're following is not the septum but the floor of the nasopharynx. That's really what you're following. Some tips to make it better: relax. You have to be relaxed. Try and relax the patient. Try and calm them down. You have to be patient with them. You have to spend some time counseling them, and you really have to try and get them to be a bit comfortable. Most persons are apprehensive. Most persons are nervous. It's a nervous experience. You can't really blame them for that. But for patients, when it's going through the nasopharynx, one of the best advice that you can tell them to do is to swallow. When you swallow, it kind of eases it off and makes it much more bearable. All right, so you just swallow. For some persons, when it goes to the nasopharynx, you are going to feel like you want to sneeze. You are going to feel like a little burning sensation. It shouldn't really last that long if it's done properly. The next thing is never ever aim up. That is when you're going to feel like it's going into your brain and it's going into your earth. It's just going where it's not supposed to go. So don't aim up, don't angle up. Just go parallel with the head just slightly flexed. I really hope this helps somebody. The nasopharyngeal swab does not have to be a scary thing. I know a lot of persons on my who I've seen on social media and whatnot are just terrified of it. And then we have so many videos out there of people just having a really bad experience. I'm not saying that all the time it has to do with technique. I think a lot of time it has to do with the fear and the fact that it's really a sensation that you're just not used to feeling. Again, if you've had a good experience or you've had a not so bad experience, please spread the word. Please tell your inner circles so that they aren't afraid of reporting symptoms and because they're afraid of getting the swabs. If you are having any signs or symptoms that are in keeping with COVID, report it. Call the hotline. Let somebody know. Let them do the risk assessment and let them decide. Don't let your fear of being swabbed or even your fear of having the disease put you in more danger or put your loved ones in more danger. COVID-19 is here. We're living with it, but we have to do the best possible and ensure that we're protecting ourselves and that we're protecting those around us. So if you have any questions, if you have any suggestions, or you want to share your experience with how it was for you, please just share them with me. Comment below wherever I'm posting this. And yeah, stay safe, tan your yard, and keep your distance. I've just always wanted to say that.